Amongst worldwide cholera epidemics, outbreaks of the disease in London and Newcastle in 1853 killed more than 10,000 people. In 1854, after striking Southwark and Lambeth, the outbreak hit Broad Street of Soho, London in late August, killing 127 people in the first 3 days. By September 7th, only one quarter of Soho's population remained. Due to the increasing mortality rate, a scientist named John Snow began to gather samples off the Broad Street water pumps. Upon observation, he noticed white flocculent particles in the water source. Snow was able to trace the disease back to water contamination, a relatively unheard of cause of illness. Therefore, he began tracing water sources down the Thames River, and specifically to two major water companies, Southwark and Lambeth. Southwark got their water downstream of a sewage dump, resulting in source contamination, while Lambeth, located upstream, remained unaffected. This discovery explained the massive variability of sickness in different cities. During this time, people were 933% more likely to die from cholera by ingesting contaminated water from a company such as Southwark. Snow continued to research the Broad Street outbreak and focused on Southwark as it was the pumped source of water and had a high level of contamination. The cholera spread was traced to a single point source, a cholera-infected baby whose diaper wash water was emptied into a cesspool which leaked into the Broad Street water supply. This contamination resulted in more than 600 deaths from cholera. He convinced the governors to remove the pump handle and cut off water supply to the Broad Street pump. The incident rate went down drastically after action was taken. Cholera is a waterborne disease. This means that it is caused by pathogenic microorganisms thriving and transmitting in water. Waterborne diseases can be spread via ingestion and contact with contaminated water. Cholera spreads easily when the water is contaminated with fecal matter. Cholera produces the potent toxin CTX when in the small intestine. The toxin binds to the intestinal walls, ultimately leading to the rapid loss of fluids and salts due to the osmolality differences between the intestine and the blood. The onset of cholera can be very sudden, resulting in diarrhea and vomiting. Affected individuals lose fluids from their body at a rate of up to 20 liters per day, causing severe dehydration. The excess fluid loss causes the skin to become turgid, blood to be sludgy, and the organs to shut down one by one. Since the body has lost too much fluid, it cannot form the plasma it needs to sustain itself, eventually leading to the death of the individual. Biological revelations pertaining to cholera and the transmittance of the disease had not been made at the time. They attempted to treat it via bloodletting through leeches, opium, and strong herbs. When the water samples were compared, it was discovered that the Southwark water had 4 times the sodium amount than the Lambeth water. When patients of the disease were tested, the excessive diarrhea caused a loss of water and sodium. It wasn't until the 20th century that sodium was discovered to be a key component to blood plasma, ultimately leading to one of the modern-day treatments of cholera. It was discovered that drinking glucose would help a cholera-ravaged intestinal system take up more saline, allowing for the body to once again produce plasma. One long-lasting impact of the Broad Street epidemic is the change in the way we treat our water supplies and sources. With increased knowledge and understanding, the levels of pollution in these bodies of water has fallen drastically in developed countries, resulting in an overall increase in drinking water quality globally. During the time of the Broad Street epidemic, cholera was viewed as a poor man's disease as it was prevalent in the lower class, where poor hygiene and working conditions were more common. The lower class believed that they deserved a better standard of living, and when they found out that the epidemic was preventable, they used it as an example of why there needed to be social reform. The upper class was receptive, and soon realized that cholera outbreaks were caused by the dirty and poor living conditions, and not the wrath of God. The government also listened and started to take public health and sanitation more seriously by forming health boards, gathering data on sickness, creating quarantine regulations, and making an effort to improve sanitation. John Snow founded the Epidemiology Society of London in 1850, which was one of the first medical societies to look at cures for diseases, how to treat symptoms, and study the disease itself. In disease study, they focused on transmittance, propagation, and environmental factors, allowing them to contain diseases. The Broad Street epidemic was also known as the grand experiment in the field of epidemiology, due to Snow publishing his findings in his book On the Mode of Communication of Cholera in 1855. The maps he made to better understand the contamination were published as innovative disease maps, also known as Voronoi diagrams. John Snow's discoveries were a major stepping stone to shaping the world we currently live in, and how society views diseases. It inspired the innovation of the modern infrastructure that we rely on to this day. To commemorate his contributions, the Broad Street pump has been turned into a monument, without a handle, of course.